Herpes zoster is an infection of the nerves supplying certain areas of the skin, caused by varicella zoster virus, which also causes chickenpox. After an episode of chickenpox, the virus can remain dormant in nerve cells for several years and re-emerge as shingles. Symptoms include itching, tingling, pain, and rash that turns into blisters, which gradually crust over, leaving scars, usually on one side of the body.
Shingles is a skin rash caused by varicella zoster virus, the same virus that causes chickenpox. It is a painful skin rash, usually with vesicles, and occurs in a cluster or band localized to a small area of the body. Shingles occurs when the virus that causes chickenpox becomes reactivated. After one recovers from chickenpox, the causative virus becomes dormant in the nerve roots. In some people, it remains dormant forever, while in others, the virus gets activated if the person becomes stressed or has a weaker immune system. In few cases, certain immunosuppressive drugs may also cause activation of the virus. The initial symptoms one may feel are itching, tingling, or pain in the area. That's where the rash will appear after a few days. The rash will turn into a cluster of vesicles. Then these vesicles break into small sores which will dry and form crusts. These crusts will fall off by themselves in 2 to 3 weeks. Other symptoms that you may experience include abdominal pain, fever and chills, general ill feeling, genital sores, headache, joint pain, and swollen lymph nodes. During the shingles attack, especially when skin blisters are present, the virus can be transmitted to people who have never had a varicella virus. In general, these are mainly children. Varicella infections can be harmful to newborn babies. Therefore, people with active shingles need to avoid contact with newborn babies. In elderly, shingles can occur when they come in contact with children who have chickenpox infection. Shingles usually gets healed by itself without any treatment. Treatment is recommended when shingles is present on the face or when one has low immunity. Treatment of shingles includes prescription of an antiviral, anti-inflammatory, and antihistamine medicines. Antiviral drugs such as acyclovir may be prescribed to fight against the virus. It is best to start taking antiviral drugs before the vesicles appear. Anti-inflammatory medicines such as prednisone are given to decrease swelling and pain. Also, painkillers and cool wet compresses can help reduce pain. To speed up drying of the vesicles, daily application of a zinc-containing ointment can be used. Shingles can be prevented by avoiding contact with people having shingles or chickenpox and getting vaccinated with the herpes zoster vaccine. For any further information or advice, you can best consult your family doctor.
Shingles is a painful skin condition in adults caused by the chickenpox virus. also known as the varicella zoster virus. If you had chickenpox as a child, you still have the varicella zoster virus inside some of your nerves, but not in active form. For unknown reasons, the varicella zoster virus may become active again in older people or those with weakened immune systems. The reactivated virus travels along your nerves to your skin, causing symptoms such as numbness, tingling, and pain. A red, blistery rash quickly follows these symptoms. Shingles normally happens in a single patch on one side of your body. It may also happen on one of your shoulders, on the side of your neck, or head. Within 3 to 5 days, bumps in the rash fill with fluid and become blisters that look like chickenpox. Next, the blisters fill with pus, which forces them to break open and begin to scab over. When the scabs fall off and the blisters heal, the pain usually goes away. These symptoms usually last 1 to 2 months. You may experience a complication of shingles called postherpetic neuralgia, or PHN, which is pain even after your rash has cleared up. Other complications of shingles include vision loss if shingles occurs around your eye, pneumonia, hearing problems, brain inflammation, neurologic problems, and skin infections. Both the chickenpox vaccine and the shingles vaccine can dramatically reduce your risk for getting shingles and postherpetic neuralgia. Although there is no cure for shingles, antiviral drugs such as acyclovir can speed healing and reduce the severity of the rash when taken within 3 days after the rash appears. To reduce pain, your doctor may recommend over-the-counter pain medication, calamine lotion, cool compresses, and an oatmeal bath. For severe postherpetic neuralgia, your doctor may prescribe medications such as gabapentin.
Shingles. Introduction. Shingles is a disease that causes severe pain and blisters in the face or the body. Up to 1 million Americans are affected every year by shingles. The same virus that causes chickenpox causes shingles. The disease is also called herpes zoster or zoster.
This patient education program explains shingles. It discusses the symptoms, causes, complications, diagnosis, and treatment options of zoster or shingles.
Chickenpox. Shingles is caused by the varicella zoster virus, the same virus that causes chickenpox. After an attack of chickenpox, the virus lies dormant in nerve tissue. Dormant means inactive. Nerve cells are called neurons. They have a body and a long fiber called an axon. Orders from the brain to nerves and sensations going to the brain from nerves travel as electrical signals through axons. The brain and spinal cord together are called the central nervous system. The central nervous system receives and sends information through the peripheral central nervous system, made up of nerves. The bodies of some neurons form ganglia close to the brain and spinal cord. Ganglia is the plural of ganglion. The axons of neurons form the cable-like structure of the nerves that go to the face, chest, abdomen, arms, and legs. The chickenpox virus, varicella zoster, lies dormant in ganglia. Shingles. Only people who have had chickenpox can have shingles. After the blisters of chickenpox heal, the zoster virus lies inactive in the ganglia of the nerves. As a person gets older, it is possible for the zoster virus to become active again and cause shingles. The virus travels from the ganglia through the axons and reaches the area of the skin that is served by the neurons. In the skin, the zoster virus causes a painful outbreak of blisters or a rash. Although it is most common in people over the age of 50, anyone that has had chickenpox is at risk of developing shingles. About 20% of people who have had chickenpox will get shingles at some time during their lives. Most people who get shingles get them only once. Shingles is more common in people with weak immune systems. The immune system is the part of the body responsible for fighting off germs and foreign materials. People who have shingles can transmit the zoster virus to people who have never had chickenpox. However, people who have had chickenpox cannot get shingles from people who have shingles. Causes.